Welcome to this talk by the Australian Institute of International Affairs. This is a hybrid event being held both in person in Brisbane and also online for interested members and members of the public throughout Australia and internationally. My name is Graham Kerridge and I'm a member of the State Council of AIIA. I firstly wish to acknowledge the traditional custodians of the land on which we are gathered for the event, the Turrbal and the Jagera people, and pay respects to their elders past, present and emerging. Secondly, I wish to thank the University of Queensland for facilitating the event through making available this room. AIIA has long had a very productive relationship with the university and we thank them for that partnership. We're very honoured tonight to have as our speaker Associate Professor Shah Hamiri. Dr. Hamiri is an Australian Research Council Future Fellow and an Associate Professor in the School of Political Science and International Studies at the University of Queensland. He is a political economist who has awarded his PhD at Murdoch University. He's published widely in journals focused on Asia and the Pacific, particularly with respect to the evolving nature of statehood and political agency. His most recent book, co-authored with Dr. Lee Jones, is out this year from Cambridge University Press, titled Fractured China, How State Transformation is Shaping China's Rise. Tonight, Dr. Hamiri will be talking on arguing with success, COVID-19 and the failure of Australia's regulatory state. We'll be discussing what he sees as a broad shift across Australia and Western democracies in recent decades, the government's moving away from the role of governing to a role of governance through regulation. This shift, he suggests, has compromised the ability of governments to respond effectively to major public health and economic catastrophes, and advocates that countries must learn to govern again. Dr. Hamiri will talk for about 30 minutes, after which there'll be time for him to answer questions. If there are questions from the online audience, it's requested that these be sent through in the chat function on Zoom. We'll finish the event at 7 p.m. Please make Dr. Hamiri welcome.
Thank you very much for the generous introduction. Should I be standing here, or is that... because normally I'm accused of having a voice that's too loud. Thank you all very much for coming on a cold, such as it is, Brisbane night. Now, this talk that I'm going to deliver here today for you, it looks at the politics of COVID-19 in Australia. And this is not really what I should be working on right now. In fact, what I should be working on right now is my future fellowship project, which looks at China's development financing and how other countries are competing with China about, who's going to receive what and how. But, this little thing called pandemic happened over the last year and a bit, and I got dragged into thinking and writing about it. And increasingly, I got somewhat exercised by what I could perceive to see were Australia's problems in response to COVID-19. But what I, at least for a time, thought was not really noticed by a lot of other people, certainly not in the media. Now, no one will disagree that Australia's headline figures are absolutely fantastic, among the world's best. I don't think anyone will dispute that. And just here for you, I've got this table from the Financial Times, and you can see down the bottom there, can't see in detail, but you can see the arrows, and they show that Australia's excess mortality from COVID-19, anyway you skin it, are among the best in the world, absolute best, maybe top 3 in the world. And we also know that the number of cases in Australia is very low compared to other countries in the world. So you might ask yourselves, what is the problem? Well, lucky you came to this particular talk, because I'm going to tell you what the problem is. Before I get into that, I think it's important to talk about Australia, not just because we are here in Australia and many of the people listening are probably Australians, but also because Australia has been held up as a model for a lot of other liberal democracies. These are headlines for some notable publications from around the world. You see CNN saying Australia's COVID lockdown strategy worked. Could this be a model for the United States? how Australia brought the coronavirus pandemic under control. This is from the Financial Times. And here we've got The Guardian also praising Australia's response and asking why couldn't the United States and the UK do better? And we know that their responses have been very poor in terms of number of cases, confirmed cases, and also number of deaths. However, side by side with these wonderful headline figures, increasingly we've come to see, or at least some of us have come to see, that this has not come without problems. There are a number of issues that I've put there on the slide for you. Melbourne is currently in its 4th lockdown, currently going for almost 2 weeks. Previously, it was locked for nearly 4 months, for 112 days. We see that Australia's vaccination campaign is not doing particularly well by comparison to the United States and the UK, which last year looked very bad. Now suddenly they look a lot better by comparison to Australia. But it's not just the United States and the UK. In fact, by comparison to most countries, Australia is not looking very good in vaccines. We also should not forget that there are around 40,000 Australians that are stranded overseas that would like to return, but they cannot. And many of you would have heard that last month, many Australians were stranded in India, and the government, at least for a time, literally criminalized their return from India, which is something that I don't think many of us would have expected to happen to a citizen of this country. So there are, side by side with these excellent headline figures, there are many problems that are increasingly becoming apparent. Now, the basic argument that I'm going to put forward and elaborate today is that Australia's success has been premised on essentially long-term closure of borders, especially international borders, but also often domestic borders, and also the recurrent use of lockdowns. Now, both of these, when they were first used, neither of those were in the planning. I'll talk about that a little bit later. Both of those were used initially as emergency stopgap interventions to try and stem the crisis from spiraling out of control as it did in other countries. But both of them remain 15 months on the primary policy tools that Australia uses still to manage the pandemic. So my argument is that when it came to more sophisticated policy and governance responses, the outcomes were often not particularly good. In fact, in some cases, they're outright dysfunctional, as one would argue about the vaccination plan. And success hinged on the recurrent use of lockdowns and border closures. So that is kind of my basic premise, the basic argument that I'm going to make to you today. About a month ago, I wrote an op-ed that summarized what I'm talking about today. And that op-ed eventually appeared on the 7th of May with the South China Morning Post. And some people wrote to me and said, why is it in the South China Morning Post? You know, why didn't you publish this in an Australian publication? And I said, well, I tried. You know, I wrote to a lot of Australian publications, literally around 10 to 12, and no one was interested. And for quite a long time, a lot of these problems were not, I'm not saying that the media completely ignored them, but I tried to provide an underlying explanation for why a whole range of different issues were appearing in what appeared to be quite different areas. And the media was not interested in that argument at that point because the story overall was one of success. And I think that mostly the media wanted to keep it that way at that point. Fast forward a month, which is roughly where we are now. Suddenly, the kinds of ideas that I tried to put forward in that op-ed are increasingly common, especially in relation to the vaccination campaign. But it seems to me that the media has cottoned on to a lot of that stuff. But when you look at the media and what they're writing about this, initially, mostly they focus on leaders and especially on Scott Morrison, what he does and doesn't do. And they also focus quite a lot on the what you may call the blame game between the federal and state governments. Now, both of these are real and they're important. What leaders want to do and what they do matters a lot. But I want to tell a slightly deeper story here today that goes beyond the agency of particular leaders and beyond the particular kind of relationships that now exist between our state and federal governments. So basically, the argument is in front of you in a nutshell, and I'll develop some of these points a little bit more in my talk. So the first point is that the underlying problems that exist across different areas of policy and governance in Australia that manifest in this response to COVID-19 are actually the product of an underlying long-term shift in Australia between what you may call government to governance, or in other words, from more top-down hierarchical modes of governing into more diffuse modes of governing where the central agencies and especially the government retreats from directing other actors and mobilizing them together to do things, and mainly tries to steer them in fairly loose ways and coordinate these, what you may call quasi-independent actors in a broadly desired direction. So this is the kind of state that we've come to have, and this is the state that's struggling to respond to COVID-19. So this is the first part of the story. The second is that what we get because of that is a state that has its capacity hollowed out. It can't actually do a lot of things, or when it tries to do them, it doesn't do them very well. And we also see real significant problems in terms of the blurring of lines of responsibility, who's responsible for what and how, and also of accountability, who's accountable for what is happening, leading to even more blame games and the kinds of problems that we've come to see in recent times. Okay, and finally, I would say that essentially underlying the Australian state capacity to address that all these things have come together for this particular story to undermine the Australian state's capacity to address a significant problem, even though we're facing an emergency. So even in a time of emergency, the underlying structures are not fit for purpose and they're causing trouble in our response. All right, so let's go back in time a little bit. It's not going to be a long kind of historical story, but I think it's quite important to go back a bit. Like many other states at the end of World War II, you can say that was the period that many consider to be the high point of the so-called nation state. States like Australia's came out of World War II with significant capacities to get things done, to mobilize people and resources. And after the war, they mobilized a lot of these capacities in a variety of different ways in the peaceful period towards various forms of nation state building. There's a lot of different elements to this, but we see state delivering a lot more services than they used to before. We see states managing the national economy using tools that were not available before, developing new tools broadly along Keynesian lines. We see all sorts of things like that happening. In Australia, we see also certainly the federal government developing a lot more interest in delivering services and funding the states to do that. And additionally, I think it's important to understand that this didn't happen in a social vacuum, that this so-called, what you may call the high point of government, this kind of state was there also to service a particular social structure that existed in Australian society and in other societies in the developed countries around the same time. And this is the relationship between domestic capital and labor. So the state managed this relationship through the variety of institutions that were set up, and its capacity to operate hinged on this underlying domestic compact. It served both of these interests, and it did that reasonably well for a time. Fast forward 30 years, we get to the 1970s. The 1970s was a period of very substantial crisis in many economies and many societies like Australia. I think many of us today maybe don't see that as an important reference point to where we are today, but I think it is absolutely the place where a lot of the issues that we're dealing with today were begun. So essentially what happened in the 1970s was a combination of both an economic crisis and a social crisis and political crisis for that reason as well. The economies in many countries around the world entered the period known as stagflation, which combined both stagnation and inflation and stagflation. And alongside that was a return to very substantial level of social conflict, especially manifesting in industrial conflict, something that Australia, for instance, didn't suffer from very much at all previously compared to other countries. Now, this crisis of the 1970s, which took quite a long time to resolve in different countries, essentially, the way in which many elites came to see the crisis is as a crisis of the overloaded state. The state was doing too much for too many people, and that was ruining the profitability of business, and it was also ruining the economy overall. Workers were expecting too much, people were expecting too much in general. It just cannot keep on going. This was something that had to be addressed. And the way in which was addressed
is very important for understanding where we are today, because what essentially many people understood as the way out of that crisis of the overloaded state and the crisis of rising and unrealistic expectations was to make the state less responsive to various popular demands, and also reduce people's expectation from the state, reduce what people could reasonably expect that the state would do for them. The reforms that happened subsequently reflect that. In Australia, the reforms began a little bit later and in very unusual circumstances compared to other countries. In many countries, we saw the rise of what you may call the new right, Thatcher, Reagan, in the United States, and they went on the attack, especially against organized labor, which was seen to be one of the reasons why the state was overloaded. We didn't get that in Australia, and that's largely to do with the peculiar circumstances of the dismissal of Gough Whitlam, which created such a powerful rift between the labor movement and the government of the day that, and the labor movement was a lot more powerful back then, of course, than what it is now, that the kinds of accommodation that was required did not emerge between that government and that union movement, and basically that conflict remained in place until the rise of the Labor government in the early 1980s. I don't want to bore you with the details, but the start of the process that we're talking about today was actually with the Accord, which is seen by many as a high point of cooperation between the union movement and the government. But in a sense, by agreeing to wage restraint and essentially to cooperate with the government, the door was opened to subsequent reforms, many of them not undertaken by Labor governments, in fact, which ultimately weakened the capacity of organized labor to its erstwhile power and led to some of the changes that I'm going to talk about today in more detail. So what we see emerging is what you may call as Australia's neoliberal regulatory state. The regulatory state does not work like the command and control or the more directive state that we had post-World War II. It operates through the central agencies, as I said before, retreating from directing into coordinating and steering. And the way in which that operates in Australia has what you may consider to be 5 different elements. These elements have emerged slowly over time. They're somewhat uneven, so I don't want to make it sound like all of them came at once, but ultimately these are the factors that are there now and that shape our response to COVID-19. The first one is the change from previous forms of federalism, which were never perfect and were always contested, into what has been called the regulatory federalism. In Australia, the federal government, the Commonwealth, has enormous fiscal capacity compared to the states. In fact, it controls 80% of all taxes, and it has complete control over income taxes. And it has used that, different governments have used that in a variety of different ways to get the states to do what they want. I mean, obviously, it's a more complicated story than that, but that enormous fiscal imbalance played a very significant part in giving the Commonwealth government the capacity to try and shape what the states do. Regulatory federalism means a shift from essentially the kind of traditional federalism that we've seen into a variety of different fairly loose networks operating in different issue areas where the federal government tries to regulate what the states do in this area and often brings in other actors that are not just the relevant governments, but may come from the third sector or other parts of society and the economy. And the structures were created to try and coordinate that mainly via the Council of Australian Governments. But we know that in practice, a lot of these structures were used as mechanisms for especially from the Commonwealth government to try and bring in various reforms at the state level that support whatever policy objective they've had. So federalism has become a lot more fragmented as a result of that and tends to be organized around particular issue areas with COAC acting as some kind of a coordinating mechanism for that wide complexity. The next element of the story is the emergence of or the enforcement of independent policymaking agencies within the state. Mostly these are regulators. So as markets were created in a variety of different areas where markets were not there before, the state-created regulatory agencies, and many of those are independent, and their mandates are to regulate in the interest of competition or efficiency, relatively narrowly defined mandates, generally speaking. But probably the most important independent agency in the Australian state is the Reserve Bank of Australia, which sets monetary policy, and it does that independently. Now, many people would argue that's a good thing, of course, and you know, there are probably reasons to say that. But what that does is it makes it a lot more difficult for the central government to coordinate all these different bodies together towards a shared objective. Next, there is the emergence of outsourcing as a very substantial activity of government. We're talking about outsourcing both of the actual delivery of services, but perhaps more importantly, we see increasingly the outsourcing of development of policy itself. I had a look, and in 2019-2020, the Australian federal government spent around $720 million, if I'm not mistaken, on consultancy alone, okay? And we see that emerge again as an issue in the response to COVID-19. The problem with consulting is not necessarily just the fact that consulting happens, is that it's drained a lot of capacity out of the state in particular areas. So there are areas where consultants are so significant to policy development that public servants cannot even evaluate really well whether the consultants are giving them good advice or not. So that's another element of the regulatory state. The next element is that of privatisation. Many people talked about that, so I'm not going to get into that, but a lot of assets have been privatised and state-owned companies have been privatised. Again, reducing the capacity of the central government to direct the state. And finally is the issue of the marketisation of service delivery. So where services historically were given to people via public agencies, many services at least, increasingly a lot of these services were either marketized fully or markets were created alongside public delivery. We see that happening in education, we see that happening in health, of course, but you know, just to give a recent example, we see a major program like the NDIS delivered largely through market mechanisms. So the government is offering the funding, and then various providers competing in a market, and they receive vouchers. There have been some studies, this is not my area of expertise, but studies, for instance, that looked at the capacity of the network that, for instance, the employment service network to actually do its job. And a lot of these studies have found that these services were not actually particularly effective at putting people in jobs, but they continue to receive enormous amounts of money. So this same process is actually manifested in many other areas of policy. Now, each one of these things combined together has again led us to the point where the central agencies find it really difficult to actually get this wider, quite fragmented array of agencies, most of them operating quite independently at arm's length, to get them to work together for a shared objective. So this is what I mean when I talk about the capacity of the state to do things being hollowed out. All right, so what is the problem here? Let's get a little bit more into the pathologies of this regulatory state. I mentioned already that state capacity has been hollowed out, meaning that whereas a state, someone sitting at the top of the pyramid at one point could direct the state to do things, now that is no longer possible, that they need to rely on you know, agents that they do not control directly. They may have different agendas or interests, but there are other issues as well. For instance, like the blurring of the lines of accountability and responsibility. It's not actually very clear, and I'll give you very concrete examples pretty soon from the story of COVID-19. It's not actually very clear, you know, in many areas of policy, who's actually responsible for what, and exactly who's accountable for when things go wrong in this case. In many cases, what we see is the emergence of very elaborate plans, but these plans, they're not plans for action in a traditional sense where there's a clear strategy and responsibilities are allocated and then funding is dedicated towards the achievement of these objectives. Many of these plans that we see emerging to try and coordinate this vast state, or you know, the sort of range of agencies that are operating broadly under the Australian state, the regulatory instruments, they allocate broadly responsibilities, and broadly define targets, and then leave it largely for these other actors to do what they're supposed to be doing, mostly independently, and then try to audit the extent to which they've done what they're meant to be doing. So what we're seeing a lot of the time emerge is, instead of actual capacity to do things, we see layers of regulation where underneath actually no one is resourced and has the willingness and capacity to actually get real things done in the real world. And instead of real capacity, we get a lot of box ticking. So organizations become pretty good at being seen to be doing something about something, ticking the boxes that the plans suggest that they should be ticking. But actually, when you strip that away, there's not really that much underneath that. Now, I put this at the bottom there, but I also said an element of the story is also the collapsing trust in democracy and in our institutions, which ironically, actually, COVID-19 seems to have reversed somewhat. If you look at 2019, you'd see that trust in Australia's democratic institutions was probably at its lowest in history, according to many surveys. COVID-19 seems to reverse that because the response did seem to work relatively well compared to other countries. However, maybe that would be a temporary sugar hit. We don't know at this point. But the point is, when there is lack of trust, it's also a lot more difficult for the state to mobilize the wider population. And we see that emerging in the context of the vaccine drive. There's just a certain kind of lack of trust towards institutions that I think is hampering the drive. But I'm not going to talk about that too much today. Maybe we can talk about that later. All right. So moving directly into COVID-19, the first thing that I'd like to talk about briefly is how this regulatory state that I just described to you manifested in Australia as rather inadequate preparedness for a pandemic. Australia has been supposedly preparing for a pandemic for at least 15 years. There have been plans put in place going back to the kind of mid-2000s that talk about Australia's preparedness, especially for a pandemic influenza event, which is what essentially was seen to be the highest risk. These plans are of the nature that I described before. There are more recent plans that go beyond just influenza, talk about other potential infectious disease outbreaks, and they are regulatory plans. One of the key elements that I think makes some of these plans interesting is that there is actually no funding directed towards allowing the states, for instance, to implement what the plan said that they should broadly be doing. Okay, the plan specifically said no dedicated funding would allow is provided. Agencies need to find it within their existing resources to implement a lot of these demands. Additionally, we've seen the emergence of what people have called a plandemic. So there's a national plan, and then there are state plans, and there are other plans, and there are also aspects of the plans. And a lot of these things have emerged side by side. They speak to each other to a certain extent, but the plans themselves need a degree of coordination. So there's a fair bit of planning going on. But the question that I'd like to ask is, what was actually underneath that funding? Was there a lot underneath that funding? The evidence shows there wasn't that much. So firstly, I already mentioned that the federal government is the one with the money. They actually have the money. The states get funded a lot by the federal government to do things, but they actually need federal government funding for at least 50% of what they're doing. They don't raise as much of their own revenue as they need, because they're responsible for delivering most services. So as I mentioned, the plan did not allocate any funding, but what did the federal government do other than that? Well, not a lot. They basically funded 2 national drills. The last drill happened in 2008. And the recommendation at the time was to run one every 2 years, but we know that didn't happen. There are a number of smaller exercises, but certainly no national drill. So we didn't really know whether the system was fit for purpose in the lead up to COVID-19. So that's one thing. The second thing that the federal government funded directly is the National Medical Stockpile. The National Medical Stockpile is supposed to be a strategic reserve where we have personal protective gear and various medicines and other things that we may need in a state of emergency. We know now that that was grossly inadequately funded. The entire value of, and I've got this here for you, I don't think the picture is clear enough, so let me just describe it for you. This is from the Australian National Audit Office audit into the management of the National Medical Stockpile. In 2019, just before COVID hit, The stock of PPE, which is that green bit at the top there, was worth $10.76 million in the national medical stockpile. And there's also a sliver that they can hardly see that was for medical equipment that was worth $28,000. In the 2 months after the pandemic, the government spent over $3 billion on these things. And then the value of the national medical stockpile rose by June 2020 from around $130 million to about $2 billion. So we know that that medical stockpile was nowhere near resourced enough to deal with something on the scale that was required. So that's the federal. The state and territories have their own problems. We mentioned before regulatory federalism. So the government used regulatory federalism quite seriously, especially after the global financial crisis, as austerity started to bite in the federal budget. They rolled on the cost of the austerity onto the states in many areas. They made it harder for the states to see their funding increase, even though the actual needs were increasing. So we've seen a few things happen. Firstly, we've seen the share of health funding that the states have relative to the federal increase in relative terms, which is very substantial given that health is the biggest expense that states have. We've seen public health investment suffer quite a long time before the crisis. If you go back to the 90s, Australian governments were spending about 6% of public health overall on public health. By the time we get to the 2000s, 2010s, we're looking at about 1.5% of all health funding into public health, which is preventive stuff, you know, the kind of stuff that you may need if you have a crisis like we're facing. And I looked into it, and granular data is not always available. It's pretty hard to find for some years. But if you look at the latest year that I was able to find really granular data, 2015, you find that only about 12% of that 1.5% total funding was actually dedicated to various measures to control pandemics. And pretty much all of that money was coming from the states. Hardly any of it was coming from federal. It was about 90% at that point. Additionally, research that's looked into it have found that Australia trained relatively too few public health professionals. There was no national registry, so these were assessments that were done by various researchers. But one study that was led by Rayner McIntyre found that in the whole country, there were probably around 1,000 professional public health professionals, but no one really knew exactly where they were, and a lot of them were not actually employed by government. So it would have been very hard to draw on that surge capacity in the case of crisis. If you look at public health physicians, the situation was even worse. We're talking about around 240 in the country in that period. And modeling that was done by the association representing the public health physicians using a consultancy group found that even though their numbers was predicted to grow very slowly, the demand for their services, this is before the crisis, yeah? The demand for their services was predicted to grow even slower than that. And that's because states were not actually investing in public health capacity, nowhere near enough anyway. So that led, again, the study that was led by Rayner McIntyre led them to model what would happen to Sydney if it came under a bioweapon attack, because that was her main interest at the time. And what she found was that even if the initial attack only got 100 people, then the contact tracing system would already be overwhelmed because it was just not robust enough. And what was also lacking was planning for surge capacity, hospital beds, and all these other things that may be required if that was to occur, if contact tracing was to fail. So, you know, the warning signs were there before the pandemic, but they were not enacted. They were not acted on in a very substantial way. Okay, finally, we get to the actual response to COVID-19. Well, we know that the initial response in many countries was quite slow. In Australia, there are reports of vast amounts of PPE actually being purchased here and sent to China. This is as late as January and February. I'm not suggesting anything nefarious here, just that the problem was in China and people were purchasing it here and sending it over there. But the government was not actually doing much about it at the time. The main thing that we did do that was unusual was a travel ban on non-residents returning from China that was imposed very early on the 1st of February. Arguably, that played a very important part in the success of what happened. But stories that emerge, even though they were denied, suggest that the reason for that ban was because the government here believed that the virus may have been released from the lab in Wuhan. So they were very concerned and they imposed a travel ban. But once that happened, when we get to March, things happened really quickly. And what's central to all that happened after that was the closure of borders and the locking down of cities. So on the 20th of March, borders closed to all non-residents. Tasmania also on the same day closed the internal borders, and then other states followed. On the 25th of March, a nationally coordinated lockdown was put in place. We all remember that. And then on the 27th of March, mandatory hotel quarantine managed by states. Now, this is important because the hotel quarantine system, when it was made mandatory, also restricted the number of people that can come into the country. Because the number of people coming here was dictated by the number of people that hotel quarantine system could take, which was not that many. And hence, we see many Australians stranded overseas. Nonetheless, this led pretty much to the elimination of COVID-19's community transmission because there weren't actually that many community cases in Australia at the time. You can see here, this is in March. Basically, this is the line for community transmissions. This is from overseas. Both of them declined by the time we get to April, but community transmission in Australia was not very high. And that helped the outcome be favorable, as we said. But there are also a number of very substantial problems in these early days that this headline success, in a sense, masked. Without going into those in any great detail, some of the more significant ones include, for instance, the shortage of PPE. This is a picture that was taken of a doctor, I believe, dressed in a rubbish bag instead of a medical gown. Now, this shortage was eventually addressed, but it took about 2 months for it to be addressed properly. And there are a number of other issues going from from the sublime to the faintly ridiculous, like the COVID Safe app, that was pretty much from the beginning faulty. So what we're seeing is border closures and lockdowns becoming initially and remaining so the main policy response of the Australian government. It's critical to underscore that neither of those was part of Australia's pandemic planning, and any planning was in fact not in any state's pandemic planning, any country's pandemic planning before COVID-19. Now, you might argue, okay, well, plans are always fantasy plans, a crisis hits and everything gets thrown up in the air and then you do what you have to do. You can say that. But what's, I think, interesting here is that we're still here 15 months later and these responses remain our main responses to the pandemic. So we've seen a consistent and quite long-term failure to try and move forward from these early stopgap emergency responses that were taken from somewhere off the plan. Now, these failures actually reflect, as I indicated previously, the failures of Australia's regulatory state that are described above. And I'm going to go very briefly into hotel quarantine and the vaccine program. Hotel quarantine was invented over one weekend. It was not in any plan. There was no capacity, no planning. There was never even any study to show whether hotels were a good place to put people in case of a pandemic. It was implemented over one weekend, and the states were tasked with delivering it, as we know. Now, I'm just going to focus on Victoria just in the interest of time, but we know a lot about what happened in Victoria because of the inquiry that was published, the report of the inquiry, and we know that the extent of confusion about who is even responsible for delivering the program was absolutely so extreme that when ministers were asked who gave the order of employing private security in order to guard these quarantine hotels, no conclusive answer emerged out of the entire inquiry. It was just left as one of those things that no one could really quite explain. Both departments thought the other department was responsible for the outcome, and the contractors on which the response relied actually argued in the inquiry that they didn't get too much information about what they're actually meant to be doing. The training was entirely left up to them, and they trained their guards quite differently. Some of them did better jobs, some of them didn't do a great job. The result was a leak that ultimately ended up locking down Melbourne for 112 days. Now, this is not a one-off. Since 2020, there's been 17 leaks at least, and arguably almost every one of those led to a lockdown pretty much without fail. Now, a recent study suggested that out of infected cases, 1 in every 204 leaks out of hotel quarantine. That's not a great rate. So this is a highly faulty program. We can't seem to be able to move on from it. When it comes to vaccine, we also see the faults of the regulatory state in action again. The federal government essentially took over responsibility for it largely from the states, attempted to deliver the plan largely through a fragmented network that used a lot of independent contractors, private sector contractors, and also GP clinics. That was bungled, and we know now that many of the promised vaccines never emerged. Announcements were made before the people that were meant to deliver even received the vaccines. We know that residents in aged care facilities were often not vaccinated or in disability care at very high levels, with the government not even being able to often tell how many people were vaccinated. And we know that the workers were not vaccinated as well. There was also a very significant reliance on advice from consultants that I mentioned before became a common feature of Australian government. In one egregious case that was recently publicised, essentially McKinsey & Co. received a contract to provide advice on government vaccine strategy that essentially took information that was publicly available on the WHO vaccine development website and then published that, provided that as a report and charged handsomely for it. Now, we're seeing the states starting to almost do things their own way, trying to kick off their own vaccination programs, but all of that is in a state of considerable confusion about the supply of vaccines going forward. Not all of that is the government's fault, of course, but that is the kinds of, these are the kind of pathologies that I was referring to. Finally, we see in response to all these problems, maybe the provisional return of more command and control forms of governance into the Australian response. We've seen the military and the police increasingly take active roles doing things that generally they're not meant to be doing. There was even an article that I read today arguing that the increasing use of the military to deal with pretty much every emergency suggests the extent of unpreparedness. And very recently, we've heard that a general that was previously in charge of Operation Sovereign Borders would be given charge of a task force to deliver the vaccine program. So that seems to be a bit of a shift, a bit of a rediscovery of command and control modes of governance. But that is relatively incipient at that point. So let me just finish on this. We've certainly seen headline success. That headline success masks a lot of policy and governance failures that are increasingly harder to ignore as we move from that immediate emergency response towards something that is meant to lead us out of this crisis. So what is the lesson that we're going to learn from this crisis? What do we actually learn from this? We're supposed to be a model for the rest of the world, but we know that we have these problems. So what can we learn from the Australian experience? I think what we can learn from the Australian experience is that the government and governance processes that we had in place were not fit for purpose. And therefore, if we want to deal with similar crises, which are likely to come in the future again, we want to do better rather than rely on fairly kind of crude mechanisms like lockdowns and border closures. We need to relearn how to govern, okay? We need to rediscover our capacity to govern. We did it before, we can do it again. And with that, I'm going to leave you and open up for questions. Thanks.
Thank you, Dr. Mary, for that very, very broad talk tonight. And that can lead off in multiple different directions. I would like to start off by asking as to whether the description that you have given to how Australia has responded and the failure of what you say is the regulatory state response in Australia, as to whether that reflects what you observe in the countries that we are familiar with elsewhere, particularly the United States and the UK.
Absolutely. I think that the same problem certainly manifested in the United States and in the UK, also to a significant extent in many European countries as well. I think that we've seen some very significant differences, for instance, in how countries like South Korea respond to the crisis. They managed to keep mortalities down and avoid a runaway outbreak. generally without locking down their societies. And that reflects a very different relationship between state and society, very different kinds of states. So I think that that's probably an interesting comparison for us if you want to take that further. But in terms of the broad governance and policy failures that I've seen here, we've seen similar ones happening in the UK and the United States. The main exception there was largely that of not closing down the borders, which I think did, in my view, play a very substantial part in getting that outcome.
Thank you. Paul.
Thank you, Shahar. Can I put a proposition to you? John Blaxland, Senator Jim Molan, a number of federal Labor politicians have been talking long and loud about Australia's national resilience. We now have 2 oil refineries left. They're being funded finally. We've seen the problems with PPE. We've seen the difficulty in getting pharmaceuticals. Does that require us to have a rethink now in the terms of our national sovereignty when it comes to producing essential goods? We're self-sufficient in food. That's not a problem for us. How should we then approach things? Because post this pandemic, again, PPE will be cheaper from China than it will ever be in Australia. We have to reassess the cost of things in terms of a long-term view.
Yeah, I think that's a great question. Some of the questions are a little bit above my pay grade in terms of the complexity of the issues involved in setting up these things here. But I agree that the pandemic has really raised a lot of questions about long supply chains, especially for essential goods like medicine and PPE and things like that. So I would certainly recommend having that conversation. I think it's pretty important. The one about the oil refineries, I think, is critical. And the fact that we've been without that capacity and with such limited oil supplies reserves for such a long time is, to me, quite surprising. But yeah, I mean, we've seen the same thing with the National Medical Stockpile. I think that for a long time, issues of efficiency and other objectives dominated, and maybe I think we need to think a little bit more, longer term about some of these issues and their implications. So I would certainly back that kind of conversation.
I've got a question about, you mentioned the lockdown planning and the absence of lockdown planning in plans that we had to address the issues of pandemic outbreak. My understanding is that within epidemiology that lockdowns were not within the teachings of at least Western epidemiology. Where politically, at what level was the decision to take that extreme approach after criticising China so vehemently about the way they went up in their lockdown? Where was that decision made within Australia's sort of federated system?
Well, the story, if you want to read a bit more about the kind of ins and outs of that critical weekend, I would recommend reading Catherine Murphy's quarterly essay. She really kind of goes into the nitty gritty of what happened, but it was basically the National Cabinet, which was formed at that point on the 13th of March, was formed by Prime Minister Morrison with the premiers, creating a new process, which is sort of like COAG, but a little bit more leader to leader. But as I understand, the demand came from mainly New South Wales and Victoria. The state governments, they were concerned about a situation there akin to what we've seen in Italy at that time, which was collapse of the health system and just hospitals not coping with the large number of people sick and so on. So as I understand, that was the story there. But similar things happen in other countries. There's also a fascinating interview by not Niall Ferguson is the historian, Neil Ferguson, who's the researcher from Imperial College that was responsible for a lot of the modelling in the United Kingdom. And he says something like, and I'm paraphrasing here because I can't remember exactly, but it was a bit like, we never thought we could do this, but then the Chinese did it. So we did it too. That's basically what he says. He said, we never thought anyone would accept it, but we saw them do it. Then the Italians did it, and then others did it as well. So yeah, it was never in any planning.
Other questions? Paul.
Can I put to you the perverse situation that both the UK and the US were massive failures when it came to protecting their people against COVID illness and death, but perhaps the reason that they are a success in vaccinations is the population of those countries saw the devastation if you're not vaccinated. And in many respects, in Australia, we're back to the same old, it won't happen to us because we're isolated and protected. And that's a reason why many Australians haven't been as motivated to get vaccinated. And we've seen a trend against that only recently with Melbourne and people finally seeing it is serious, mate.
I think you're right about that. I think that in countries, not just the United States and UK, but other countries that suffer massive outbreaks, generally the willingness to get vaccinated was much higher. And also the emphasis on driving the vaccination program was a lot more serious. One of the reasons why the UK and US vaccination programs did actually work is precisely the argument here. They moved from this mess into, which both of these countries suffered from, into actually quite kind of old school, top-down command and control vaccination plans, you know, and they rolled it out very quickly once they got around to doing that. In Australia, we haven't gone there, and you're right about the sense of urgency. It's just not there. I think that...
But I'm putting you as partly the population's fault as much as it's government's fault.
Well, I think that it's... Given the supply problems that we have, I think that to say that it's a population's fault, I wouldn't necessarily accept that. I think that if we had a well-run program, well delivered, and then people didn't do it, then I'd accept your point. But given that we don't have that, then I think in the world of, I'm not an expert on vaccine campaigns, but generally they say take care of supply first, then hesitancy. That's what they say. But we haven't taken care of supply, so we can't talk about hesitancy first, you know, because that's not how you do it.
Dr. Hamiri, if I can ask another question. Early in your talk, you discussed the transition from government to the regulatory state. And if I can use the term, the pathology that crept into infecting governments in that way. Did you see it? Do you analyse that was not a factor of either side of Parliament? It infected both sides of Parliament?
I would say it did, although in different ways. I think that generally speaking, you know, there was a greater commitment from the Labor Party to maintain a bit more of a state in the conventional sense, but they kicked it off with some of the earlier reforms. And later on, following some of the reforms that were put in place, they did not pull back too much from those reforms and sometimes develop their own program along similar lines. So the NDIS is the classic example. As I said, this is a new service. So you would say on one level, this is a serious investment in public services and very substantial one. But the way it was done in a similar way to the kind of regulatory state structures that I was describing here. So I don't think that the distinction between the two parties is sufficiently substantial in this case, at the federal level, that is, in order to tell that as two separate stories. I think there's one story, but within that, I told in 3 minutes. Obviously, you could tell it's in much longer, in much more detail and longer, and then you get a bit more into the nuance.
Okay, there's probably time for one more question.
Graham, do you mind asking a question from online?
Sure.
So I've got a question here from Tim Warren, who is watching on Zoom. You have emphasised a problem with outsourcing of government responsibility to public and private organisations. What about emphasising the difficulty in responding to the COVID crisis that arises from unclear responsibilities of state versus federal governments regarding quarantine, for example? You seem to want stronger government, but what about learning to adopt clearer lines of responsibility between levels of government?
Look, I agree, but I think I was trying to make the point, and maybe I didn't make it clear enough, that the blame game has always been there between federal and state governments. There's nothing new, but the kind of ways in which the blame game is played out and the intensity of it is actually reinforced by this regulatory regionalism structures that we've seen emerging. The fragmentation of federal and state government relation into a whole range of different networks in different areas that, as I said, in many cases involve other actors in implementation and policy development. And given that a lot of those processes have blurred lines of accountability and control even further, it does make the blame games more prevalent. Now, in hotel quarantine, of course, quarantine is a federal government responsibility, right? So to that extent, we know that the federal government delegated that responsibility without giving the necessary support. But that is not unusual in the way that the Australian regulatory state works. It's actually common in a number of other areas as well.
So I'm sure that you've all found tonight's talk very thought-provoking. And so on behalf of AIIA, I wish to thank Dr. Hamiri sincerely for sharing his insights for us. Please show your appreciation to Dr. Hamiri. Now, as part of our thanks to Dr. Hamiri, I'm pleased to advise that it's given a year's membership to AIIA. So congratulations.
Thank you very much.
Just before we finish up, I wish to highlight that AIIA has several interesting talks coming up, which will be posted on our website. Firstly, on the 22nd of June, Dr. Helen Bartlett, the Vice Chancellor of the University of the Sunshine Coast, and a member of the Australian Government's Council for International Education, will be talking about the future of international students in our tertiary education sector. And also on the 2nd of July, the Canadian High Commissioner will be talking about how Canada, as another middle power, sees its role in international affairs. So please put those dates in your diary and keep a lookout for formal notices in your on our website and in your emails. So thank you for joining us for this most interesting evening, and thank you to the university for making this space available. Thank you.